It's game-changing orthopedic repair options. Naples-based Arthrex has done it again, this time partnering with HSS at NCH on a procedure that is just now getting up and running in Naples. Week News health and medical reporter Amy Osher shows us how a new technique is helping a promising young athlete.
At 17 years old, Sonia Karitsa is a model of determination. A refugee from Ukraine, she fled to America following the Russian invasion. And she hit the ground running here as a star point guard in high school.
I'm spending like 3, 4, 5 hours a day on a basketball court, and I feel very confident in practice, and I think it's made me feel great on the courts.
But during the first game of the season, something just snapped.
I ran in the fast break and I slipped and my knee went inside.
The result was a torn ACL, the ligament that stabilizes the knee. Sonia had surgery using donor tissue from her quadricep to reconstruct the ACL. The operation was layered with a cutting-edge technique. Especially when it comes to athletes who put their bodies to the test, there's always concern about re-injuring the ACL. But thanks to Arthrex, a new procedure may reduce that risk by up to 80%.
We would see these high numbers of re-injuries or re-tears. And that is not good because a second surgery for ACL reconstruction, what we call revision surgery, never does as well as a successful primary or first-time ACL surgery.
Dr. Pat Smith is Director of Research at HSS. With years of experience in ACL surgery, he used the Arthrex internal brace on Sonia.
We call it the seat belt for the ACL. We've seen less re-tears, which is huge for our patients. Get back to sport more confidently.
I asked him to show me how it works.
So here's what it looks like. This is the tape, the 2mm tape. We have 2 strands on each side of the graft.
The strands provide a safety net critical during early stage healing to support the tendon when it's most vulnerable.
In reconstructions, this idea of augmenting or protecting it is something that makes a lot of sense.
A month out from surgery, Sonia is sitting on the bench. Her practice now is rehab.
I'm spending a lot of energy on this to be back on the court.
She tackles this rehab just like she tackles basketball.
Given her determination, Sonia is playing the long game, which is someday joining the WNBA. Amy Osher, Wink News.
This internal brace doesn't shorten healing time. It's still 6 to 9 months. Dr. Smith has a lot of research and experience with this technique. Following similar patients, he's never had a re-injury.